السلام علیکم بینندگان عزیز. امیدوار هستم که در هر نقطه دنیا باشین خوش و آرام باشین. امروز بخیر در برنامه ما دکتر یما جان داریم از شهر کالیفرنیا. وقت خدا امروز به ما داده که راجع به واکسین کرونا صحبت کنیم. Thank you so much, everybody, for joining us on our weekly programming today on Sadar Haq Television. Today, we have Dr. Yamojan from California here with us again on our show. We are so incredibly proud and happy to have him back. He does a great deal of community work. And we are going to today talk about the COVID-19 vaccination. I know that a lot of community members have been reaching out to me. A lot of family members have been reaching out to me and been asking me a lot of questions that I unfortunately cannot answer. So we decided to bring a professional on today to discuss that. بسیاری فامیل هستن و دوست هستن که راجع به واکسین کووید 19 صحبت میکنن، از پیش ما سوال میکنن که آیا ما این واکسین بگیریم یا نگیریم. بازون مو وقت بود که من تصمیم گرفتم که بخیر دکتر یامو جان بیاریم و راجع به ازی صحبت کنیم. و پیش از اینکه ما شروع کنیم یک کم ذره بایوش براتون میخوانیم و راجع بهش یک کم صحبت میکنیم. So before we begin, we will read a very humble bio of Dr. Yamo John. Dr. Yamo John received his undergrad degree from Loyola Marymount University in Los Angeles. He furthered his educational endeavors in Cambridge, England, earning his MD, MBA degrees at St. Matthew's University, and his postgraduate studies were completed in Tucson, Arizona. Dr. Yamo oversees several independent clinics and surgical centers in the Southern California region. Dr. Yamo focused solely on the business development aspect of the medical industry. He currently manages Mosaic IPA and is also the senior managing director at Physician Associates Medical Group. Basically, also Dr. Yamo John is more, his independent physician association is more than just an IPA. It's a powerful network of personal care physicians, specialists, which is amazing organization that he's a part of. Also, he's an active and productive member of the community, which is what we pride him in. Thank you again for joining us today. I know that Dr. Yamojan just received his second dosage of the vaccine, and I know how, from experience of different people that I've spoken to, how hard that could be. So thank you for giving us your time. بازم ببخشیم که بیوگرافی را در این نتونستیم که ترجمه کنیم دیگه دفعه بخیر اما این دفعه میخواستیم که Dr. Yamojan و خودش to give us a little bit of background, his own words about himself and his great work.
بسم الله الرحمن الرحیم. سلام علیکم و کل بینندگان عزیز. تو از خودت فرشته جان تشکر میکنم که ما اینجا دعوت کردی به این پروگرام خوب شما و از صدای حق تشکری میکنیم که ما رو اینجا این فرصت دادن که ما که شما بیایم صحبت کنیم انشالله. من دیگه به اصطلاح نام دکتر یما مصدق، من اینجا هستم، در لس آنجلس هستیم. سالاست که اینجا بودیم دیگه درس و زندگی را اینجا آغاز کردیم. از ما که اینجا آمدیم دیگه 5 ساله بودیم. از 5 سالگی در جنوب کالیفرنیا هستیم در امریکا. دیگه اینجا باز تحصیلات و خود خلاص کردیم و یک چند وقت در انگلستان هم رفتیم، چی خواندیم، فاکولته طب و ماستری در هلت کیر انترپرنورشیپ. دیگه باز بخیر پس آمدیم اینجا در خدمت کمیونیتی هستیم. خدا کنه که از صحبت‌های من یک چیز مفید بگیرین. And I hope that our conversation today is beneficial and that it gives you information, general information, so that you can make a proper decision and get the vaccine, inshallah, and not, follow the misinformation that's out there. Our goal is to get the information out so that as many people can benefit as possible. I'm here at your service. If you have any questions, concerns, we can always email or contact Frishta John, and then we can get information to you. We want this to be an informational session that's beneficial to everybody.
Absolutely. Thank you so
Yeah.
much for that. And I do think that it's incredibly important to have this conversation within our communities. And I see that you've been doing it on different networks and different stations. And we thank you. We honor that. We really appreciate that because it's an incredibly important thing, especially amongst the Afghan American community. We do have people who are very educated, but we also have a group of people who are not necessarily educated and may not have that essential background that they need in order
Right.
to make that informed decision. بسیاری افغان هستند که شکر الحمدلله تحصیل کردگی هستند و میتونن که خودشان یک تصمیم بگیرن. اما در پاریش بسیاری افغانای ما هستند که صحیح تصمیم گرفته نمیتونن از خاطر که معلومات دقیق ندارن.
بله.
So hopefully today we can kind of square that away. So Dr. Yamajan, دو رقم واکسین است تا
بله.
جایی که ما میفهمیم، یکی مدرن است و یکی فایزر است. و بسیاری افغان هستن که میپرسن که امی تفاوت از این دوتا چی هست، امی کدامش ساید افکت داره، کدامش ما بگیریم. So there are two different vaccinations out there. One is being offered by Pfizer and one is being offered by Moderna. And our community is often confused in the differences between the two vaccinations. And also, what is it exactly that the side effects may be for each one? If you don't mind sharing that with us, that would be amazing.
Yeah, so vaccina, there's vaccine اصلا که ببین 5 رقم است. There's 5 تا واکسین هست که کمپانی ها چه کردن مگم اما 3 تا کلانش یا the three main vaccines are the Pfizer اول برآمد و اپروف شد که FDA. دومش was یعنی چیش like Moderna. That's the one من خودم مادرنا را گرفتم و دیگه سومش آله به نام استرازنیکا از آکسفورد انگلند. از اونجا که استرازنیکا کمپانی یک شد و حال چهارم هم است به نام جانسون اند جانسون. جانسون اند جانسون ان قریب اپروف میشه که FDA و یک دوز است. دیگهش که است استرازنیکا و فایزر و امی کووید چیز مدرنا اینا دو دفعه باید بگیرن. فرق زیاد چیش است هم تکنولوژی خود واکسین است. Pfizer و Moderna, the mechanism is basically they call it an RNA messenger vaccine. یعنی که این واکسین های این دو واکسین که است Pfizer و Moderna اینا را در RNA سل که یک مواد است که در از ویروس هست او را که برای شما بچکاری میکنن انجکت میکنن او بدن شما را یاد میده که چطور انتیبادی بسازن. یعنی که it teaches it has the code to teach your own body to produce the antibodies for COVID-19. So these two are mRNA virus vaccines. The mRNA vaccines are new, novel. They're not the traditional vaccines that we've been using for the last 100 or 70, 80 years. So they're new technology, and they've been working on this technology for about the last 10 to 12 years. But this is the first time that they have this technology in the vaccine. So right now, the ones that are available and prevalent are the Pfizer and the Moderna, which are similar in mechanism. They have the same way, they work the same way. The dosage is a little different. One's 100 micrograms, one's 30 micrograms. So the strength is different. That Pfizer, I think, is 30 and Moderna is 100. And they both are administered twice. دو دفعه واکسین میگیرید. یک دفعه در روز اول که میرید باز از او یا 21 روز بعد یا 28 روز بعد. Plus or minus 4 days. دیگه اینمی تفاوتش هست. تفاوت همون مکانیزمش هست که چطور ساختنش. مثلا the Pfizer, for example, it was made by a Turkish doctor in Germany and with his company BioNTech. And he made it on a computer model. He designed it all on a computer model, and then they did human trials, and then he teamed up with Pfizer to distribute it because he was a small company himself. And same thing with Moderna. Moderna is the same type where they can make it from a computer model and then test it. Now the Johnson and Johnson, is not a mRNA. It's not that type. It's the original type where they have a live virus. They give you part of the virus from COVID, and then your body produces against that massive amounts of antibodies. So that's basically the difference. Um, in terms of reacting to the virus itself, the only reactions that we see are people that are allergic. In terms of people, if you're someone that has allergies normally, اگر شما کس هستین که طبق معمول شما اساسیت دارین و زیاد مثلا در دوای اساسیت میخورین و شما زیاد به هر چیز بسیار sensitive هستین, then those people they have some type of reaction, which is, it could be a headache, سردردی, دلبدی, a little bit of lightheadedness. اینی چیزا رو یگان کس اکسپریانس میکنه. غیر از این دیگه زیاد ساید افکت خراب ندارن که بگوین که او مثلا در بعضی چیزا میخوانین میبینین که میگن او این نفرها در نروژ گفتن فوت کرده یک چند نفر. اون نفرها خودشون از 85 بالا بودن. But they had other things going on in their body. یعنی که دیگر مرضا داشتن در بدن خود که بسیار پیران بودن و ضعیف هم بودن. دیگه اینی گپ هست که بسیار مهم است که همون معلومات که آدم میگره صحیح بخونه و ببینند که چی علتی چیزاست. زیاد مثلا میگن که مردم زیاد تلف شده یا فوت کرده از واکسن، دیگر دروغ است، غلط است.
Just a few questions based upon what you were just saying that came to mind. So essentially, going back to the allergy, that really kind of struck a chord with me. So when you say allergies, do you mean like food allergies, or do you mean like allergies to actual medications? Because یعنی سوال ما بود که وقتی که راجع به اساسیت شما گفتین اساسیت غذایی یا اساسیت به مقابل دوا.
Yeah, the allergies basically, if you're someone that is sensitive in general to either allergies to if you know your allergen, it's very good, but a lot of people don't know what they're allergic to. So they get allergic reactions typically, but they know that they're very sensitive. So these people that know that they're sensitive, they might want to take an anti-allergy medication before they take the vaccine. They recommend it. So you can do that, you can discuss it with your doctor. But if you're prone to allergies in general, whether they're from, different medications or, some people have environmental allergies, some people have food allergies. If you're prone to allergies, then it could be a good idea to take, your anti-allergy medication on the morning of, when you're getting your vaccine.
Like an antihistamine, a Benadryl, something like that.
Yes. Okay. Or some people even they take like a Pepsid, or when they have antacids as well. Same thing. It's they call it the H1 H2 block, which is those allergy medications. They specifically target your H1 and H2 receptors in your body. So they tell you to take antagonists for that, which are the the Pepsids and the loratadine and your Claritin, these kind of things that you normally take.
So I normally take all of the above. So if I wanted to go in and take to get my vaccine, I would have to take like my pantoprazole. I would have to take that ahead of time and then take.
Like on the morning of, and then go. When your dog, especially if you have sensitive allergies that are prominent. Yes.
بسیار یک گپ مهم بود که دکتر صاحب گفتن متوجه باشین. برای اینکه خودم شخصی بسیار اساسیات های دارم، یکی و تکلیف اسید وقتی که یک دوا میگیرم. این حال دکتر صاحب گفت که پیش از اینکه شما اگه دارین تکلیف اسید یا تکلیف یگان اساسیات ها، میتونین که دوای خود اول بگیرین، باز بعد از اون واکسین بگیرین. So thank you so much for that is something that I have not heard and I have not. So I definitely learned something very important. Thank you for pointing that out. Also, Dr. Yamajan, the second thing that that leads me to kind of a lot of different questions and a lot of hustle and bustle about this is there's this misinformation. I don't know if it's misinformation. That's why you're here to clarify this, but there is information going around that the specifically the Pfizer vaccination is has been associated with female sterilization. بسیاری نفر هستن که میگن که اگر واکسین فایزر خانما بگیرن خدای نخواسته از اولاد میمانن. شما ایره چی میگین راجع به از این معلومات؟
Yeah. ای معلومات غلط است، مطلق غلط است. ایره که دیدن هیچ کدام تاثیر ندارد در سیستم اولاد پیدا کردن. It does not have any effect on the reproductive system in that manner. If you've heard or read somewhere that, oh, it causes infertility in females, this is a false claim. This is not something that has been shown, and it doesn't affect that system of the body in that way. Many other things affect fertility rates, but vaccines, specifically these ones, they do not affect your fertility rates. If anyone, this goes back to the general. What I would call a conspiracy theory that they said, that they had said that these vaccines are coming out to curb population growth. This was the origin of it. So اول که واکسینا برآمدن یا وقتی که چی میشدن میگفتن که میخواین که نفوس کنترل کنن و میخواین که نفوس کنترل کنن و بالخصوص کلانسالا رو میخواین که فوت کنن و از بین ببرن، چون اینمی یک گپ بود، یک در اخبارای نبود که یگان فیسبوک ها در یگان سوشل میدیا یگان کسی این گپ پیش میبرد دیگه. این گپ مطلق غلط است و ایچ اصلا این واکسین ها در مو سیستم ریپرودکشن آدم ایچ اصلا سر از اون کار نمیکنه و ایچ چی نداره، ایچ افکت نداره و این گپ غلط است. هر کس که گفته ایچ مطابق با امو ساینس و پیپرهای خود واکسین ها ایچ نیست. متاسفانه there's things like this out there. It's unfortunate, and what it does is it just prevents people from saving lives. اگر ما ببینیم خود کووید مثلا در امریکا در maybe در آخر 2 ماه آخر تقریبا از 1 لک نفر زیادتر فوت کردن از خود کووید. دیگه چیزی که آدم باید جلوش بگیره و ببینیم در انگلستان در کل مملکتایی که رکورد میکنن که چقدر فوت کردن، ببینید زیاد شده. حال پرتغال اینجا، زیاد مکزیکو اینجا، کلش در خود چین چقدر نفر فوت کرده و باید جلوی از این فوت کسایی که فوت میکنن گرفته شود و این واکسینا بسیار برای کمک میکنن و انشالله پشت گپایی در سوشل میدیا و از جایی که میگیرین و کسی میگه بسیار چیزا را مردم فورورد میکنه بر آدم در مسنجر یا در واتساپ، میگن که والا اینی گپ میزنن سر واکسینا. این گپ ها رو پشتش لطفا نگردین و خدا حفظ کنین و حمایت کنین و لطفا واکسینا بگیرین اگر براتون مساعد است.
تشکر بسیار زیاد دکتر صاحب. I mean, these are incredibly important points that you've hit on. Especially the fact that it's so much easier to spread false information. It's so easy for people to get wrapped up into the hype. We're home. This is now I'm gonna put my psychology hat on. We're home, and a lot of the clients that I deal with in my intervention work, I've heard people have a lot of time on their hands if they're not out and about, and if they don't necessarily have jobs that require them to be time consuming. They're at home. So now we have a lot of time, we have a lot of technology, and we sit down and reread everything. And pretty much let's try to filter out these conversations and filter out these forwards and these tags and these things that are steering people away. I'm sure that each one of you that are watching this program today has lost, I can tell you I've lost at least 5 people to COVID-19 in the past 10 months, close family members. And this should be a huge wake up call. If you haven't lost somebody, you definitely know somebody who's lost somebody. This is a very, very serious pandemic. This is not something to to toy with. And also think about the pros versus the cons. Think about how many people have succumbed to this and why, like Dr. Soip has said, people that are elderly, people that have comorbidities. I know my friends that are in the hospitals and that are out there risking their lives every day. They see people in their 20s succumb to this, and this virus does not have this concrete kind of umbrella of who passes from it and who doesn't. So بعضم متوجه خود باشین، بعضم لطفاً افغانای عزیزم حتما در فامیلای هر کس مخصوصا از خودم اقلا 5 نفر ما خو از دست دادیم. بسیار یک چیز یک جگرخونی است در ما و بسیار باید متوجه خود باشین، متوجه فامیل خود باشین، هر چیز را نخوانین، اگه خواندین هم هر چیز را جدی نگیرین. بسیاری نفر هستند. There are people out there who have their own agendas. Conspiracy theorists have their own agendas that they're trying to push, and they are using people to push those agendas. So be aware of that and make sure that if you don't have the information, that you reach out to somebody that does, a medical professional, because this is what they do for a living. اگر یک چیز سوال داشته باشین حتما پیش یک کس برین که بتونن که او سوالتان دقیق جواب بدن که دونمو مسلک خوانده باشه. بسیار مهم است. وقت زیاد داریم، وقت خود بسیار به خوبی تیر کنیم و با پر معلومات خوب. So that was my 2 cents about that.
Very good, very good.
Yes. So this brings me to the next thing that I've also heard of. This is also floating around not only in the Afghan American community, but also like the Muslim community. Anytime we talk to anti-vaxxers or we talk to people who have issues with vaccinations, the number one argument that they would have or debate that they would have is about preservatives. People bring up this halal haram issue of, well, what's in this vaccine? Is this something, there's a pig fetus in this vaccine. This is another thing that I see floating around. بسیاری وقت که گپ سر واکسین میایه و مسلمانای ما نه تنها افغانای ما و مسلمانای ما همچنان راجب به ازمی چیزی که داخل واکسین می باشه که در انگلیسی preservative میگین، در دری ببخشید فراموش کردم، اما مواد که استفاده میشه که واکسین جور میشه، اونمو مواد میگن که خدای نخواسته در او خوک است یا اینرمی گپام وجود داره. If you could give us a little bit of feedback on that, that'd be great.
Yes, on the ingredients of the vaccine, there are things in the vaccine that, for example, one of the vaccines that has a lipid layer, that has a fat layer, and it's from, I think they have it from polyethylene glycol. There are some smaller amounts of different chemicals that help the vaccine transport across into the cell, because our cells have a lipid membrane. So اجوره میگن سل در فارسی. وقتی که واکسین به ما میدن، واکسین باید در بدن و در اجورات داخل شد و نمیتونه که داخل شد غیر از این که گرد اجورا یک چربی است، it's a cell wall. It has to get through that wall. So either they do it with a cell membrane similar to that, like with a fat, or some chemical. این chemical اول از خوب نیست، number one. از خوب نشده و دوم دیگه خود اسوسییشن های علمای مسلمان، مثلا American Muslim Jurist Council و اینا سر از این چیزا وقت یک مقاله نوشته کردن و تولید کردن for everyone که بخوانن که گفتن که این واکسینا حلال هستن که بگیرن، یعنی که حرام نیستن. گفتن که یک چیز چی هسته، مثلا یک مؤسسه است که کلش مسلمان است و امی علمای مسلمان هستند که شناخته هستند و اینا یک جای شدن و کل امو مواد واکسینا را دیدن و کلشان یک جای به اصطلاح یک فتوا دادن که این واکسینا حلال هستند و مسلمان ها میتونن بگیرنشان. ارسیش جانسون جانسون هم استرازنیکا کووید امین چی فایزر و مدرنا کلش گفتن میتونن مسلمان ها بگیرن و هیچ کدام منع نیست هیچ کدام there's no prohibition to taking these vaccines. In England and in the U.S. and other in the Middle East, they have the Sino vaccine that comes from China, and they've all said that these things are halal to take. All the jurist councils, all the because it's important when we get something or we have an issue in front of us, we have to go ask the experts, as you said. در موضوع ما باید اما کسایی که مشخص هستن و they're the specialists in that arena, we have to ask. So in the religious aspect, the دین اسلام اینمی علما هستن و ما پرسانشان کردن و دکترها یک جوشتن از خودمون علما پرسان کردن و من بعضی چیزایشان ندارم the written fatwas and things. I have that و با خود روان میکنم که خودتون داشته باشی فشا جان باز میتونی که مردم رو شیر کنی هیچ کدام معنی نیست از نگاه اسلام و دین مقدس ما هر وقت میخواهی که زندگی ما راحت‌تر و آسان‌تر باشه و هیچ کسی هیچ وقت نمیخواه که همون زندگی را سخت بسازه برادم و کل مفهوم دین ما است که ما را بسیار to keep us healthy and to keep us functional. And the number one thing in our religion is the preservation of life. It is very important. It's very important because without preservation of life, it's one of the purposes of our Sharia. It is to preserve life. So to preserve life, you have to have those other things in line. And I think the experts in Islam have written on this and spoken on this. And I'll send it to you so you can have it, so you can share with people.
That's a wonderful
Yeah.
reference.
Yeah, and I think there's no religious prohibition to taking the vaccines, specifically these COVID vaccines. یگان کس در سابق واکسینه که میگفتن که او بعض preservatives دارن بعض مواد دارن او مواد به نام thimerosal بود او را کشیدن از واکسینا تقریبا 10-12 سال میشه شاید زیادتر که او موادی که یک ذره زیادتر اذیت میکرد مردم او را کشیدن از واکسینا و from the delivery systems so that those preservatives are not present at least in the ones here available in the West.
بسیار خوب بسیار یک معلومات بسیار خوب و بسیار مثبت که بر از او for our viewers out there who have been texting me and asking me like this is not halal, well there is your answer. Alhamdulillah that our deen is so perfect in that there is nothing done without consultation and shura. And so our scholars and our alims have gotten together and have proclaimed that this is halal. We are allowed to take this. There's nothing in this vaccination that is prohibited. Shukr alhamdulillah chun din ma Islam on qadar اساس است و قدر perfect است که همه علما که یک جای شده کانسل داشتن گفتن که این واکسین اجازه است تشکر یک جهان سپاسی بسیار یک گپ مهم است و همچنان it's very interesting that there's one thing that when we think about this rigid kind of like halal versus haram, there are very few things in Islam that are actually haram. To actually state and use that very, very strong word, there are very, very few things that are actually black and white prohibited. And you have to be very, very careful, unless you are specializing in this particular field, to kind of make blanket statements. We leave that for our scholars and for the ulama to be able to kind of come together and bring those decisions about. We have to be careful as to what we joke here and say like to be the haram police, right? We have to be very, very careful. And Allah subhanahu wa ta'ala has given us our bodies and our lives as a gift that he expects to be returned as close as to the nature in which he gave it to us. وجود ما را خداوند تعالی الله سبحانه و تعالی داده مثل یک توفه واره و وظیفه ماست که مثل که اونمت پاک و سوچه به ما داده ما پس باید کوشش کنیم که او را نگاه کنیم و پس هر وقت که وقت ما بود و این توفر از پیش ما گرفت پس اونم تو سوچه و پاک و سعی کوشش کنیم. That's why in every show we emphasize all of this self-care and all of this, the wellness that we have on the show. And when I, talk about different psychological matters, the reason why we talk about this is because all of this comes under the same umbrella of preserving the human body and giving it back the way that it was given to us, essentially. So thank you. That was such an incredibly important insight. که خوب شد که شما عالم متوجه شدین دیگه نمیتونین بگوین که واکسین حرام است. And so Dr. Sip, this leads me to my next question, which is, okay, so now we've kind of really talked about important things, right? At first, there was this misinformation going around that there's two different vaccines. Right? There's four different choices that you have, essentially, and we know the differences. We know that the first two have a modern technology, and the second two are dealt with in a different way. Now the next question is, and I think one of our questions has already been answered as to should we get the vaccine? I think that we're all on the same page by saying absolutely. So the next question would be, how do we get this vaccine? Let's say that I'm watching this program right now, and I may not have that support system. I may have just arrived to this country maybe 3 years or 2 years or 1 year, and I don't know the ropes. I don't know how to go about this. طور مثال احساس کنین که یک کسی امیال برنامه ما را نگاه میکنه و نو آماده در امریکا یا در اروپا یا در افغانستان هر جایی که بینندگان ما سعی میکنه پروگرام ما را و نمیفهمن سعی که آل تصمیم خود چون گپای بسیار خوب شما زدین تصمیم گرفتن که آیا ما میگیریم واکسینه این حال چی رقم میتونن که واکسینه بگیرن؟
بله واکسین گرفتن چند مرحله داره. اولین مرحلهش بود که با کسایی که در شفاخانه کار میکنن واکسین میتن، کسایی که در نگهداری میکنن از مریضایی که کووید دارن یا رو میگن به اصطلاح فرانت لاین ورکرز، به اینا دیگه امیال تولید میشه یا 1A چند کارگر 1A 1B 2B اینا دارن دیگه. اول به اونا دادن و کسایی که مسن هستن در اینجا میگن سینیر لیوینگ هومز به این نفرا پرایورتی اول است، چون از تلفات که دیدن از معلومات 40% کسایی که فوت کردن از این سینیر لیوینگ هومز فوت کردن. از خاطر از اون میخواین که اول به دکترها و نرسایی که یا حفظ و تکر میکنن و دوم دیگه به خود سینیر لیوینگ هومز اینا که خلاصن بعد از اون به کسایی که از 65 بالاستن به کل از یک سر به کل آل ما در اون مرحله هستن ببخشید به کسایی که از 65 بلند هستن و هر کانتی و هر استیت مثلا در امریکا که اگر باشن خود امو کانتی یک مقدار واکسین از فدرال گورنمنت از حکومت میگیرن و اونا رو توزیع میکنن به این ترتیب دیگه. اینا شما میتونین که اول کت کانتی تان به تماس شوین و بعض وبسایت ها هسته که میرین رجیستر خود میکنین و اونا شما را اپوینتمنت میتن میگن که اینجا بیاین. مثلا در لس آنجلس ما که اینجا هستیم، اینجا یک سپورت استادیوم است به نام داجر استادیوم، اونجا روز 10,000 تا واکسین میتن. اینال بعضی نفرها اینال وبسایت رو میگیرن اونجا خود رجیستر میکنن، نام معلومات تان میتن باز اونا با شما یک وقت میتن تعیین میکنن بس میرن. اینال و اونا شرایط میگن که حالا در کدام مرحله هستن. حالا دیگه مرحله است که امی کسایی که از 65 بلند است کل از اینا میتونن که خود رجیستر کنن و برن بگیرن و کسایی که اینا را تیک کیر میکنن. بعضی کسا دارن که چیزو میگن هلپر میگن یا کیر تیکر و مثلا اگر خود مادرت تیک کیر میکنی و خودت کیر تیکرش هستی خودت میتونی بری واکسین بگیری خود رجیستر کنی اگر 65 هم پایان تر باشه. doesn't matter. So these people, so right now it's the healthcare workers, frontline workers, people that are all 65 and above, people that are living in senior care homes. These people they all have the green light to get the vaccine. So they can go and register in their county websites, or there's other websites that are being formed for all these, what they call super pods. Like here in Southern California and Orange County, they have Disneyland. Disneyland is a super pod. People go there, daily. They get 5,000 to 8,000 vaccines. So people register, and you put everything in, and you go. I took my parents to Disneyland, and they got their first vaccine. And this coming up week on Wednesday, I think they're getting their second one. So it's important for the young people to get on the computer and register the elderly and get them, because they can't, they're not computer savvy. So if they have a grandchild or a child that they can go do it for them, or a younger friend, you register them and you go and they give you your appointment, and you got to keep trying. It's the computer system. It'll say it's booked, but you got to keep trying until the slots open up. And that's what they do. And then the third option is you can call your primary care doctor. So your own doctor, you can call them. میتونین که به دکتر شخصی خود زنگ بزنین و بگین که ما میخوایم که واکسین بگیریم، چطور کنیم. اونا هم بر شما اطلاعات میده و معلومات میده. و دیگه کسایی که مثلا if you have another condition, for example, if you're 65 and younger but you have asthma, you have some type of disease that you're at a higher risk, you can push for that, and they're giving vaccines to those people as well now. So the vaccines is basically going to be an issue of supply. The supply is increasing slowly. The previous administration hadn't bought enough, but now they've put in the purchase orders for enough to cover everybody. So within the next 3 to 6 months, the goal is to get everybody vaccinated. So you'll see a lot of more super pods setting up in different big cities, and the most important thing is don't worry about which vaccine you're going to get. Just register and get whatever that's available and get on the schedule. It's very important. The عدد vaccine که available باشه چی باشه؟ Pfizer باشه، AstraZeneca، Johnson and Johnson، Moderna، هر کدامش که باشه و برای شما امو available است، خود رجیستر کنین و بگیرین بخیر. واسه خاطر که واکسین ها از بیشتر از 75% حمایت میکنن. One other thing is very important, these vaccines, they decrease the severity of illness and disease when someone gets it, and they prevent death. So that's the important thing, where I had a colleague friend of mine in a hospital. She got the first vaccine. Between the first and second dose, she got COVID. And for her, it was just, a little bit of mild symptoms. She had sneezing, a little bit of sore throat, and, she went on, and it was very mild because she had had that first vaccine. So that's what it does. And it makes it livable. And it's very important, especially for our seniors and elders, because we don't want them to be compromised. It's important to keep that in mind. And بالخصوص با کلان سالا بسیار مهم است که واکسین بگیرن، چون بعض کلانای ما مسلمان دیگه پرابلم های چی دارن، مریضی ها دارن و خدا نخواسته اگر کووید بگیرن مریضی های دیگهشان هم یک ذره زیادتر شدیدتر میشن. و کوشش کنن که خود رجیستر کنن و اولادا یا نواسا رجیسترتان کنن در کامپیوتر و برین لطفاً امو واکسین بگیرین. بسیار مهم است.
یک تشکر بسیار از این معلوماتتان. یک چیز دیگه که بسیار دکتر صاحب گفت مهم است که هر کدام واکسین که بود شما بگیرین. رقمش که برای که خدای نخواسته چانس خود از دست ندین در لیست، باز باید معطل بانین. چقدر آدم در این وقت معطل باشه و نمقدر ریسک آدم بلند میشه. و همچنان من یک نصیحت آخر دارم که بسیاری نفرها مخصوصا افغانای ما در کلتور فرهنگ ما هست شاید نگوین که ما کمک کار داریم اما داشته باشن. right? So کوشش کنین که زنگ بزنین برای کلانایتان، بزرگایتان، فامیلایتان، پرسان کنین که شما کمک کار دارین، ما براتون اپوینتمنت جور کنم، ببرمتانه. I mean, part of community service work, and it's one thing for family members, but also if your family's self-sufficient and they're able to do it, then that's great. We do have a lot of elders who are able to drive and who can kind of do it on their own. But let's reach out also to your community members. If you are somebody who has that a little bit of extra time, and you could just hop on the computer and take 10 or 15 minutes, it doesn't take very long to register somebody and help them out. reach out to people who you think might need that help. Part of our duty as community members, but first and foremost as Muslims, is to be there for each other, especially during this extremely difficult time. وظیفه ماست مسلمان هستیم الحمدلله اول پیش از همه چیز مهم است که ما کمک کنیم اون نفرایی که ضرورت داشته باشه. Dr. Saib, you've given us a lot of your time. I wanted to ask you if you had any advice or closing thoughts for the audience and the community today. Anything that you wanted to offer to them?
Yeah, one thing that I wanted to mention was that in the US, they've done a survey of how many people have gotten the vaccine thus far. So in the percentages that they saw that greater than 60% of the people that got the vaccine were white females. White females. So a lot of people say there's a lot of these Karens that are going around, and in one instance they found one lady that had a YouTube podcast against vaccines, but yet she herself had gotten the vaccine. So it's very important to realize that people are being misled on the opposite end. So it's important because a lot of the minority communities and the especially African Americans and Latino and Hispanic communities, they're suffering, and they're having the most deaths from COVID because of misinformation. There's a lot of fear and this type of information where people say don't take the vaccine, it's gonna infect you or kill you, or it's causing this or that. بعض اقلیت‌ها در امریکا یک سروی کردن، دیدن که زیادترین کسایی که واکسین گرفتن 60% بیشتر بود خانم‌های سفید از خانم‌های سفید، و در یک ریپورت دیدیم که خود یک خانم سفید بود که در یوتیوب و در فیسبوک کلا میگفت که واکسین نگیرن، مگم خودش واکسین گرفته بود. و این بسیار یک چیز مهم است که میبینین که بالخصوص ایگاپایشان سر امو اقلیت ها تاثیر میکنه. مثلا بین سیاه و مکسیکویی ها میبینن که بسیار مردم میترسن که واکسین بگیرن، میگن که والا واکسین ها ما رو میکشه و بسیار چیز خراب است و این کار میشه، که در حالی که کمی نفرایی که امی گپا رو برشان میزنن خودشان واکسین گرفتن. و این نشان میده که یک چیز مهم است که شما باید خودتان اشار جان خود شوین به اصطلاح. And you have to have advocacy for health. It's important, and information and knowledge is the number one thing. It's very important to be an advocate for your own health and be aware and cognizant of what's going on around you. And don't let people discourage you from getting your own health care in line and taking care of yourself and getting your vaccines and taking care of even all your other medications. You might be on a lot of our seniors are on 10 to 12 medications, and they've been on it for years with nobody has checked on it. Nobody has looked into it as why are you on all these medications. So we have to be health advocates ourselves in this system, because there's no national system. Nobody actually takes care of you except you yourself or one of your loved ones. So when it comes to your health, you have to be an advocate yourself. And when it comes to these vaccines and you see what's going on around us, people are getting the virus, and there's a percentage of people that do very bad with the virus. And it's important, even when you do get the vaccine, to still wash your hands, wear your mask, keep social distancing until 70% of the population gets the vaccine, so we can move towards herd immunity.
Yeah, no, absolutely. And also on the other end of the spectrum is that this wonderful campaign that's going on with, there, due to what's happening to the marginalized communities, there's this great campaign that when people are getting vaccines, they're posting pictures, they're posting
Yes.
their cards, and I read something out there that was like, why are people doing this? Well, people are doing this because guess what? If I got it, I'm
Yes.
okay, I've lived, then you can get it too. And I'm a woman of color, and I'm able to survive through this, and you're a gentleman of color, and you've been able to get through this, and you're fine, and you're going to live your life. It's almost like a living testament, right? like یک ثبوت وارسته بسیاری در سوشال میدیا شما حالا ببینین که هر کسی که دکتر هسته یا در فرانت لاین ورکر هسته، واکسین خود که میگیرن، یک عکس میگیرن امروی واکسین، امروی کارت خود، برای که میخواین تشویق کنن مردم خارجه، مردم سیاه پوسته، مردم اسپانوی را که زیاد تشویق میشن که نگیرن این واکسینه. ما برعکس باید حمایت کنیم و تشویق کنیم که بگیرن واکسینه.
Right, right.
So there's the negative hype and these Karens and all of these conspiracy theories out there who are trying to push one agenda. But alhamdulillah, we also have this other agenda that's being pushed to encourage people to take these vaccinations. So thank you so much for also bringing up that really important point.
No problem, no problem. Thank you, First John, for having us. And if you have any other questions, any concerns, you can always reach out to me. And, I'm at your service, no problem.
Thank you so much, دکتر صاحب. اگر کدام سوال داشته باشین برای دکتر صاحب یا کدام کامنت داشته باشین، در زیر سکرین ما جای است، میتونین شما نوشته کنین کامنتتان یا سوالتان، و همچنان نمره تلفن ما در زیر سکرین است، میتونین که شما زنگ بزنین و سوال کنین. If you have any questions for Dr. Yamajan, you may place them in the comment box underneath the screen. Also, there's a phone number. You can give me a call, and I'll be sure to get you the answer that you need in a timely manner. And this is an incredibly important issue. And of course, to close off this show, again, I would like to thank Dr. Yamajan for giving us his time, his energy, his efforts, not only for this show, but for the community at large. یک جهان سپاس. تشکر دکتر صاحب از وقتتان، از کار بسیار مهمه که شما برای کمیونیتی ما میکنین و تشویقی که شما میکنین. خداوند تعالی اجرش بده برای شما و فامیلتان همیشه. And از طرف صدای حق تلویزیونم یک تشکری خاص. در هر نقطه دنیا که هستین و باشین، خوش و آرام باشین. خداحافظ.